Welcome to the show discussing problems and issues of health with Dr. Alcena. For this segment of the show, I'm going to continue to talk about osteoarthritis. When I left off last week, I began to evaluate patients who present with symptoms that is consistent with osteoarthritis. Osteoarthritis is one of the most common diseases across the world. I dare say there must be more than 1 billion people across the world with osteoarthritis. In this country, the number keeps rising and rising. Earlier today, I read a report from the CDC that 40% of American adults have now discovered to be obese. 40% of all American adults in this country are obese. How do you go from obesity to osteoarthritis? You cannot be obese, then ultimately you have to develop osteoarthritis by necessity. You say, well, how so? Well, the bony structure as created by God was not made to be able to withstand this excess weight. So when someone is obese, by necessity, all the lower back, the hips, the knees, the ankle, the feet, those things cannot carry that excess weight without problems. And the most common problem, of course, happen to be osteoarthritis as it relates to the bony structure. I have done several shows over the years about obesity. I'm not going to bore you with that again, but obesity is a major, major medical problem. Of all the developed countries in the world, there are more obese people, even before this report that came out today, than any other developed country. And of course, the reason's pretty obvious. It's the fast food. There's no question about it. Unless one has thyroid that is malfunctioning, which is significant but not that big in number. When you are obese, it is the diet plays a major role in it. The low basal metabolism gene, yes, that is a gene that causes obesity, that is associated with obesity, that originated from Africa. We know about that. I'm not going to bore you with that. That's been documented and proven. That's one of the ideas that I came up with many years ago before my hair became gray. That was subsequently proven by the Rockefeller Institute in New York City through research. No question about that. But however, the diet is the key problem. You cannot be obese, live long enough without having developed diabetes. Obesity is associated with high blood pressure, heart disease, stroke, abnormal lipids, and so on and so on. This is a very bad problem. And of course, how do you go about solving that problem? That's another issue. Bringing that back to obesity, therefore to osteoarthritis, there's no way the lumbar spine can withstand the excess weight without you developing a lot of problems, including low back pain. No way the hips bone can handle the excess weight without developing symptom of pain in the hips, which is of course due to osteoarthritis. No way could you be obese and ultimately wind up with severe knee problem, requiring multiple, sometimes knee surgery being done by orthopedics, etc. The ankle, the feet. These are major issues, okay? So last week I spoke about the evaluation of the patient, taking the history, the physical exam, the work-related issues, etc., to all the tests that I talk about, all the tests, the blood count, the blood chemistry, the urine analysis, the thyroid profile, the SED rate, the ANA, the rheumatoid factor. I talked about all that last week, what those things mean. I talked about the x-rays, the plain x-rays that one can do much more easily to make sure one without a fracture, or you could actually see degeneration of arthritic changes in the plain x-ray as well. However, the most important radiological test that need to be done is basically the MRI. Because on the plain x-ray, you can't see the ligament. And one of the most common things that is involved in osteoarthritis is degeneration of the ligament because the gel-like material that is inside the ligament to allow you to attach it to the joint dried out as part of the aging process, etc., or trauma or what have you. So therefore, you must do an MRI. I'm fully aware that the HMOs will give you a fight when you're going to do an MRI. I mean, they're all-out fight because the MRI costs a little bit of money. If you do the X-ray before, then you have a better chance of getting the MRI approved. The whole concept of pre-approval to get things done in this country that the AMA and other organizations are actively fighting as I speak is a disaster. These folks have no soul, no heart, no human feeling at all. It's all about money and power, telling doctors what to do. A great deal of the time, it's a fight to get to speak to another doctor on the telephone. The people that are getting things approved, you have to go through to get things approved. Some of them are not even nurses. And if you get to a point, you pass the person that got the first stage, then you're going to speak. If you're lucky, you're going to speak to a registered pharmacist. Pharmacists are great people, great profession, but they don't know anything about medicine. They really don't, okay? And you got to sit there, try to explain to them things that they have no clue what you're talking about. They have these bizarre, tricky questions that you have to answer. And God forbid, if you answer one the wrong way, that's it. You're done. You're cooked. You're going to be denied. Then you got to go to the appeal process, which is disgusting. You have to fight so hard to get to peer to get to speak to another physician who would understand what you're talking about and go ahead and get the thing approved. It is, and they do that on purpose. Who came up with this idea? Nobody knows. And it's now completely, totally out of control. There's no pulling back because you have hundreds of billions of dollars. The healthcare system in the United States in 2020 is about $3.5 trillion. And people are coming out of woodwork. Some of them barely make it out of high school. They got connection, they got a great job in the healthcare field. You can't make this up, okay? You have people under my care, patients under my care, somebody with my qualification, my experience, and I have HMOs sending nurses at home to evaluate patients that are under my care and other people, under physicians like me. And they get paid for doing it. Nurses are great people. We need nurses. Right now there's a shortage of nurses. When I got sick, I wouldn't be here talking to you, wait for the incredible care that I get from the nurses. They're fantastic professionals. But, you know, there's easier job out there than working on the floor, which each nurse is getting on average in New York, an average of 7 to 8 patients. An average of 7 to 8 patients, okay? And the hospital organization has tremendous power in Albany and other state, Senate and Assembly. They get lobbies to fight to dump more patients on the nurses. I have nurses that I work with say, when did you go for, I haven't got a break. The whole working without a break, not even have time to get lunch. It's disgusting. Okay, so this is what's going on. I can't change it. I mean, I have this opportunity of sitting on television to talk to you about it, and the United States being the United States of America, I have this First Amendment right. As a journalist, they can't stop me from talking about it. So if they could, they would. Right now, they're actively doing everything under the God's sun to come up with something that they can use to discredit me so that when I say something, they say, well, you know, look at what he just did. Okay, that kind of nonsense. This is what I have to deal with. Okay. So therefore, then, once you get all your evaluations set up, you fight to get the MRI of the lumbar spine. You fight to get the MRI of the hips. You fight to get the MRI of the knee, which is crucial. You might find an effusion. You could find the effusion in plain X-ray as well. Last week, I promised to take a lot better time to talk about the effusion, how crucial the effusion is. The effusion is basically fluid that accumulates in a joint. A joint could be the elbow, could be the knee, it could be any joint. That's crucial because you don't know what the effusion is. It may not be because of an inflammatory reaction that involves the joint that causes the effusion. It could very well be an infection. That is the most crucial thing. If you have an infection in a joint and you don't diagnose that quickly, the joint is going to be destroyed. So you got the effusion, you see it in the knee that the orthopedic doctor as a consult or you yourself before the orthopedic doctor can get there, clean that thing up, put a little bit of local anesthesia, and you're going to tap the joint to remove as much fluid as you can as a treatment itself because the fluid is causing a little pain. You remove as much as you can. Then you want to do two things. How much did you remove? Because you got a big syringe. What color is the fluid? Is it bloody? Is it cloudy? Is it pussy looking or whatever? Or a combination thereof. Then what do you do with the fluid? Because you must do something with this fluid quickly that's going to allow you to make a quick diagnosis. Well, the fluid has to be divided. One part goes to the chemistry laboratory. One part goes to the microbiology, and one part goes to the hematology laboratory. The part that goes to the hematology laboratory is there to do the cell count mainly. Do the cell count, and then also to do a smear, regular smear of the fluid that is dried out, and stain it with gram Giemsa, and look at it under the microscope. And it tells you what type of cells are you seeing there. Is it a tremendous amount of white blood cells? Then that raises the flag. Then you count them. You count the cells. Okay. It's just a lot of red cell or a combination thereof. So that's what the hematology laboratory is going to do for you by doing the cell count and also the smear under the microscope. So that's one part of it. What is it the microbiology laboratory is going to do for you in the fluid? Two things. One thing, they're going to take part of it, they're going to culture it. Well, that takes a minimum of 72 hours to get a result. However, acutely, you're going to take a little bit and put it on the smear, dry it out, smear it out, dry it out, and stain it, the gram stain. That's crucial. The gram stain goes immediately. The medical technologists were going to put that under the microscope and tell you is there bacteria in there, because they can tell there's bacteria. If there are bacteria, what types of bacteria? Is it a cocci? Is it the gram-positive cocci? Is it a rod, gram-negative rod? Those are crucial things because that information is going to be relayed to the doctor in his office or her office or the emergency room doctor immediately. Right away, you know you're dealing with an infection because you find bacteria under the microscope and the gram stain. That changes. See, that's crucial because just because somebody is having pain in the joint does not necessarily mean it's just arthritis. You will be fooled. And then, before I tell you the different things that can cause the infection, let's go back now to the chemistry laboratory, which is also crucial. What do you do with that fluid? Well, you're going to take the fluid, you're going to test it for three things. You're going to test it for glucose, protein, and LDH. That's right, you're going to do test it for the amount of glucose that's in it, test for the amount of protein that's in it, and test for the amount of LDH. Okay, crucial. What is the importance of that? Well, if you have an infection in a joint, the glucose in the fluid is going to be low, the protein is going to be high. So far, so good. If it is just an inflammation, the glucose is going to be normal, and the protein is going to be high. If it is an infection, also the LDH is going to be high. Why is that? Why is the glucose low on an effusion and the protein is high? The glucose is low because the bacteria is using the glucose as food to survive. That's the point. And then another part of the fluid also goes that you look for crystal. That is, the hematology can do that. You look for crystal because you may have an effusion. It may be gout. That's right. Because you can have gout and osteoarthritis at the same time. Of course, happens all the time. So you have to understand your test is in the laboratory. Your uric acid, because you have to send a uric acid, that's maybe pending. But the hematologist technologist just tell you, I have crystal. There are two different types of crystal. You could see the gouty crystal, you could see the pseudo-gout crystal. Now, I must tell you, however, those things that I just explained to you, not my colleagues, not all of them know. I happen to be a licensed medical technologist. How about that? I spent years doing this thing that I'm telling you in the laboratory before I even know that there's something existed called medical school, okay? So my experience is that it is not fair, frankly, for me to expect my colleagues to know this technical thing. Years ago, before it was stopped, when we were in training, we were allowed to do these things ourselves in the middle of the night when we were on call. If you recall, there was a tragedy in New York City. I wouldn't name the hospital that occurred. Somebody, a family member of somebody, I think the editor of the New York Times, I think she died, frankly, because of somebody did something that wasn't quite right, according to them, quote unquote. I'm just quoting. And because of that, a committee was set up by somebody who also happened to be one of my teachers at Jacobi, who was head of that committee. I don't want to name name. And because of that, it was stopped. Across the country, no longer people in training are allowed to do laboratory tests on their own. How about that? But prior to that, when we were on call, we would send the stuff to the lab, but there were, at Montefiore, there were, on Cloud, there was a lab. I believe it's on the 5th floor. So we'll have to take the specimen that's ourselves and do our own thing during the night, so that by the time we're presenting a case 8 o'clock in the morning to our attending, we already did the test ourselves. How about that? Those completely been eliminated. It's unfortunate, really, because of that one case. That was a horrible case, I'm telling you. But because of that, they canceled the whole thing, and the doctors that are presently trained, and I train some of them myself, they're not allowed to know this stuff. They know what's in the book, what they hear in the lecture hall, but they never had a chance to do it themselves. So that's a big deficiency right there, okay? Big deficiency. Because people like myself, when we train, we had to do it. Let me give you a little vignette before I continue. I'm one of those that was always fighting for the right of patients. So there was a time at Montefiore, the house staff decided they wanted to go on strike, so to better their condition that they were working, because they were killing us 36 hours straight. It was a disaster, okay? I mean, we were working like, you can't believe that. One time I was on call for the weekend. We had to work, all of us had to work one full weekend per month. It was my weekend to work. So it meant that you show up Saturday morning, you don't go back home until Monday night. Well, it so happened that I was on call. I was supposed to start at Maurice Senior Hospital Monday morning. I knew nothing about this, nothing about this. I completely forgot until I got a call Monday morning around, my goodness, must have been 8:30. Somebody cursing at me on the telephone. Where are you? Where? I said, oh yes, Val, you're supposed to be here. Oh my God. Now, I just been on call for the entire weekend. Now, I'm also on call at Morrisania. And then when I get to Morrisania, there were 2 patients in the emergency room on stretcher waiting for me to take them upstairs. Those are my patients. You can't make this up. I never get home until Wednesday. And I've been on call since Saturday. and I'm driving this big old car that I had from where Jerome Avenue and the Grand Concourse, and I was so confused. I drove the wrong way until this big guy coming at me with his Cadillac almost blasted me. He hit Buddy's horn. That's when I realized I was driving on the wrong way, going to try to the Grand Concourse. This is a true story, okay? So in any event, when the strike, when the House staff decided to go on strike, I didn't disagree with the issues they were fighting, but I didn't think doctors should go on strike. That was my personal view. So what do you think I did? I worked as a regular house staff during the daytime, then I'd run the lab at night. This is a true story. For the number of days that strike lasted, I worked all day as a medical staff and all night running the staff by myself because the tech also joined the medical staff and as part of the strike. A few years ago, some lady that was involved in me being appointed at Montefiore had some issues about me not admitting enough patients. I said, lady, let me tell you something. Let me finish. I told her that little. She said, oh my God, you did? I said, yes, I did that. So when you see blood on the floor as you're walking into the Montefiore, that's my blood and my sweat. Don't you dare tell me about how many patients I should admit in order for me to be reappointed. You understand that? So I work in the lab. Myself, we run all the labs, one person, because that's what I used to do. I used to run all the lab anywhere at other hospital because I had all the licenses, 7 of them. I still have them. So therefore then, when you take a look at that fluid, you must know what to do with it. Then that gives you an idea as to what to do. If it is just the arthritis that's causing the effusion, it doesn't have to be osteoarthritis. I'm talking about the other kind of arthritis that I'll be talking about several weeks from now. I mean, as I continue talking about arthritis problems, it could be a lot of different types. Suffice it to say that effusion will only have high protein, normal sugar, and then some cell in it, and that's another story. That it is just an effusion associated with that. There will be nothing wrong with the sugar. The protein will be high, yes. No crystal will be found. The cell might be a few here and there, and then the gram stain will be negative. The culture is going to back negative. So what you did then, the orthopedic doctor or you or yourself and the ER would have removed enough fluid so as to give the patient some relief. And then this particular patient who's developing fluid require steroid. The most acute medication that you could come up with to treat this person that's going to accumulate happen to be steroid, okay? And then this happened to be Black History Month. Let me get one more grateful thank for Dr. Percy Julian, a black guy, a Negro guy, who lived right here in Greenberg, passed at age 76. Dr. Percy Julian is the gentleman who invented corticosteroid. That's right. He was a biochemist. And they would not allow him to get his PhD in the United States of America because he was a Negro. So Dr. Percy Julian had to go to Scotland. That's right, went to Scotland to get his PhD. When he came back, of all the dozens of stuff that this man did, corticosteroid happened to be one of it. There's no major profession today, specialties I should say, in the field of medicine that's not using corticosteroid across the world. As we speak, I dare say corticosteroid is the #1 medication in use across the world. And nobody mentioned anything about Dr. Percy Julian, okay? Even some of the people who are in the field of rheumatology, the new one, they know nothing about Dr. Percy Julian, okay? If you want to read what was written about him when he passed away by the New York Times, there's a copy of it in the No Shell Public Library. You could read it. Fantastic. The amazing thing this guy did, including helping the U.S. to win World War II, because when the Battle of Normandy was heating up in the middle of it, it was the foam, F-O-M, that he invented that was used by the U.S. to put out the fire on the U.S. tank as they were being being blown, shoot up on by the German. They would keep moving because they was able to turn the fire off. When you have in your house today, that little fire hose thing you have in your house, the foam, that's Dr. Percy Julian who invented that as well. Okay, I mentioned that because someday, years from now, I will no longer be here, and I hope somebody will have enough decency to say this is also what Dr. Alcena did. So I thought it was important, this being Black History Month, to mention to you that Dr. Percy Julian did a lot of stuff. Spit-Klein Laboratory, that was his laboratory. Upjohn Laboratory, that was his laboratory. I can go on and on, all the stuff this man did. And you hardly hear anything about him. Okay? Look at the contribution that this man made, okay? A black man. In those days, we called them Negro, okay? So you will give the patient steroid. You could actually put the steroid in the joint. The orthopedic doctor will do that locally. And then the patient will be put on steroid by mouth. Or if they don't want to give it actively in the joint, they can give it a dose intravenously in the emergency room. And the patient will be started on NSAID. The best NSAID to do acutely will be Indocin. Speaking about treatment, therefore, when you have osteoarthritis, the most common treatments, besides steroid, the steroid can only be used acutely. You can't keep somebody permanently on it because of the major side effect that it has. It's all the NSAID, any one of them. Pick one. There are at least a dozen different NSAID, from Advil to Aleve to Motrin, Naproxen, go on and go. And of course, you could also use Celebrex, which is not an NSAID per se, but you could also use Celebrex depending on which one the patient can tolerate. And aspirin. Across the world, aspirin is the cheapest one people have access to who have arthritis of different type. In this country, we have access to NSAID, but in the developing countries, they can't afford the NSAID. People use aspirin. Okay, so the NSAID, aspirin, steroid, those are really the mainstay of the treatment to relieve the pain from osteoarthritis. Be careful because these things have side effects. They can cause GI bleed. If you have kidney insufficiency, they can make it worse. You got to follow the advice of your doctor, who would do blood tests to make sure that you're getting the appropriate NSAID to relieve the pain, and the orthopedic doctor will do the surgery when it's necessary. And of course, physical therapy plays a major role as well in relieving the symptom of osteoarthritis, etc. That's all I have to say about osteoarthritis. Next week, I'll talk about other forms of arthritis. Until such time, keep watching the show. This is Dr. Alcena saying so long and bye-bye.